We'd like to thank everyone for tuning in this evening to Life Sciences of Washington, How to Eat to Live, Facebook channel, Nature's V, Autoimmune Disease Foundation, YouTube channel, and Nature's V, natures-v.com. Tonight, we are here with Mr. Victer Muhammad of Life Sciences of Washington, Inc., a bio technology company. Mr. Victer Muhammad is the creator of liquid low-dose alpha interferon, the first person to create this protein in this form. And tonight we'll be chronicling the low-dose interferon alpha Saga Volume 2. Welcome this evening, Mr. Victer Muhammad. How are you?
Thank you for having me. I'm well, and how are you, sir?
I'm fine. Thank you for asking. Tonight we want to get right into a video that has been around for about 2 years, but Mr. Victer Muhammad has never had the opportunity to address the video nor state the facts as it relates to what's in this video. And this current video that we're dealing with is a interview that was done by Original Man Scientific, and it was done back in October, I believe, of 2018. And we'll go right to the video now. Please excuse the way we have to show it. We just had some technical difficulties. Please excuse the way we have to show it. We just had some technical difficulties. Oh, man. Hold on. Please excuse the way we have to show it. We just had some technical difficulties. You have to excuse me. I went to the live version of it. Please excuse me for 1 second. Let me get this back to the video at hand. While we're doing that, Mr. Victer Muhammad, you have created and dealt with the autoimmune diseases as an HIV for how many years now?
31. 31 years.
When did you become aware of the protein called interferon?
In 1990.
And how did you become in contact with that?
I was doing HIV and AIDS research at the National Institutes of Health, and we were experimenting with cytokines, which interferon alpha is a protein it's a protein that belongs to a class of protein called cytokines. And we were experimenting with these cytokines on mice and rats that had been made transgenic for different proteins for the HIV or AIDS syndrome. And interferon alpha was one of the proteins with which we experimented.
Thank you for asking that question. Now we will again attempt to go to the video at hand. Hold on 1 second.
It was 1994. My Savior's Day gift to Minister Farrakhan was our own indigenously produced interferon. Yeah, wonderful. Was that Brother Victer? No, Brother Victer came later. No, the brother that I'm referring to, his name was Larry Green. Larry Green. And unfortunately, the FDA went after Larry Green and put him in prison for a while.
So what was your scientific relationship with Brother Victer? What was the
Yeah, see, so then later, again, I'm skipping through the story. There's a lot of missing details here, but at a certain point, we were actually cut off, not totally cut off, but it was very difficult for us to get the interferon from Kenya, and then it was from Australia, and then we were getting it from Canada. I mean, there's a lot of difficulty involved in it. So Brother Victer was a he was actually in the ministry class here in Washington, D.C. At the time, I was the minister here. And so I didn't really know his scientific background. He said, well, I can make that. I said, really? He said, yeah, I can make that. And so he started making it for us. And in fact, he was the one that came up with the first liquid form of interferon.
Yes, sir.
And it wasn't as stable as it needed to be, but it was good enough to get the job done. Right. And I would say for probably 5-6 years, he was our major supplier.
So thank you for that, and thank you for bearing with the video. I apologize due to technical difficulties, we weren't able to get the video played inside of the player. But I want to go over a few of the facts of what we were just dealt with, Mr. Victer Muhammad. And
Yes, sir.
the first one is, in 1994, I recall you telling me, about 1994, I recall you telling me that you came in contact with or were contacted by Aleem Muhammad as it relates to his issues with obtaining the then lozenges of interferon alpha. Can you explain that history for me?
Yes, sir. But let me begin by saying, in the name of God, the most gracious, the most merciful, I bear witness that there is but one God, and I bear witness that Moses, Jesus, Muhammad, Abraham, Lot are all prophets of God. I did that because everything that I say in this interview, I want it to be 100% factual. The work that we do here in life sciences is extremely difficult, and it's very hard work. At this time, I'm literally doing the work of about 10 different people. We are doing farm work, we're doing agriculture, we're doing biotechnology, we're doing biomedical work, we're doing a whole lot of different types of work here. And so it requires a lot of time and energy. In 1994, I was working at Howard University School of Medicine and hospital, and I was doing graft versus host disease research in pediatric immunology. I was examining the effects of cytotoxic T lymphocytes in graft versus host disease. One day in the morning in November 1994, I was contacted on the telephone in the laboratory by Dr. Abdul Aleem Muhammad. And he said to me, brother, FDA has confiscated our interferon at the airport at Dulles Airport. The patients are sick and some of them have died because we can't get the medication. Is there anything that you can do? I told Dr. Aleem that I didn't know, but I would check to see what I could do, and I would call him. I would get in touch with him. And I went and I got my immunology textbooks from graduate school, and I began researching interferon concentrations in my textbook. And I found that it was better to produce a liquid interferon product rather than lozenges or pills. And so that was the beginning of my work with interferon alpha, or cytokines period, in a clinical environment. Prior to that, it had been experimental, but I had worked with it prior to that.
What is your scientific relationship with Dr. Davy Coach?
Once I heard about Dr. Coach I guess around 1991, after Minister Farrakhan had sent Dr. Abdul Aleem, Dr. Barbara Justice, and then Final Call editor Wali Muhammad to Nairobi to meet with Dr. Koich. None of the people with whom Dr. Aleem and the clinic were working actually had biomedical research experience. None of them had actually worked with cytokines outside of a bottle where it had already been developed. And so I was the only person at that time to have actual experience in a research or laboratory environment working with proteins like that. All the other people were, for the most part, they were clinicians. And a clinician doesn't have the in-depth understanding of a scientist or researcher in a laboratory. So I began conversating with Dr. Koich shortly after they had returned from their expedition in Nairobi, because I had to get specific information from Dr. Koich, and I shared information with Dr. Koich about interferon experiences that I had had at NIH and some of my work uh, uh, with interferon at NIH and what I had done working to develop the product that became the IB100.
And what year was this that you were having these conversations with Dr. Coach?
I think it was maybe from 1992 to about 2002. Dr. Koich and I, we didn't talk often because I don't call people just to chit chat. So if there were an actual need to speak with Dr. Koich, I did have his number and he would receive my calls. And there were times, I think maybe once or twice, where Dr. Koich reached out to me.
So how long has you've had a scientific relationship as it relates to being a biomedical research scientist with Dr. Abdul Ali Muhammad?
Since the onset of the development of the liquid interferon product in November 1994. Before that, I had been contacted in September 1993 by Dr. Muhammad and then Nation of Islam uh, Chief of Staff Leonard Farrakhan Muhammad. And we had met in the hotel downtown, the same hotel where Marion Berry had been set up. We met in that hotel. They asked me to come there in September 1993. I had just completed a fellowship in molecular biology at Johns Hopkins Med School. And I was about to get married also. And so I was in need of a job. And Dr. Muhammad contacted me and asked that I meet with Brother Leonard Farrakhan, and Minister Farrakhan at the hotel. They wanted to discuss something with me. So I did go to the hotel, and Minister Farrakhan had left already, but I met with Dr. Muhammad and Leonard Farrakhan Muhammad. They told me that the minister wanted to produce interferon alpha for the Nation of Islam and Black people and also the world. And I was told that I would be paid a certain amount of money each week and that I would be the person to produce the interferon once we had secured a manufacturing facility and a laboratory. Dr. Muhammad, Brother Mark 2X, Sister Fatima, and myself began searching for a laboratory in Rockville, Maryland, and Gaithersburg, Maryland. We found one in Gaithersburg. It was fully furnished. Everything that you needed to produce proteins from scratch was already in the facility. Dr. Muhammad said that he would contact Brother Leonard and get the funds to purchase the building, and we would begin producing the product. That never happened. I don't know what happened. Periodically, I would talk with Dr. Aline to see if Brother Leonard had given him the money to purchase the laboratory and manufacturing facility, and he hadn't. So after about a month, I went and found a job because I was getting married and I needed a job.
So to go back to what we viewed on the video as it relates to the indigenous form of interferon alpha that Dr. Alim is speaking of, what is your knowledge about that product and what product was being presented at that time to Minister Farrakhan? Or do you even have any knowledge as it relates to that?
That was my first hearing that. I don't know what product Dr. Muhammad was referring to that he presented to Minister Farrakhan, because I remember, I think it was Savior's Day, maybe 1994. There was a photo on the cover of the Final Call, Savior's Day edition, where Dr. Muhammad was holding up a brown bottle that had a white label on it. This was on the cover of the Final Call. And that was the product that I had been blessed by God to produce. And I gave Dr. Muhammad that product in November 1994. If the only interferon product to which he could be referring is that product, and Larry Green did not produce that product, I produced that product by God's permission. The products that Larry Green produced were lozenges. And when I was at Johns Hopkins Med School, I tested those lozenges that Dr. Muhammad was referring to that Larry Green produced, and they were unstable and they were inconsistent. I called Dr. Muhammad to my laboratory at Johns Hopkins Med School at 12 midnight on a Saturday night. He came, Sister Fatima Muhammad came, and Brother Mark 2X, who is Mark Muhammad now of Washington, D.C. I brought them up to the third floor of the Wilmer Eye Institute, where my laboratory was. And I showed them by using the Bradford assay that the product that Mr. Larry Green had produced were inconsistent and they were not stable. This was on a Saturday night. So I don't know any other product to which Dr. Muhammad could be referring beyond the product that I gave him and the product that's on the cover of the Final Call, Savior's Day edition. I think it's 1994.
So prior to you creating the liquid low-dose interferon alpha, that cytokine or protein, did it exist in a liquid form anywhere on the planet?
It did not. Not according to all scientific journals, and nothing that we'd seen in publications or in data. If it were available, it was not known to the modern and not known to the scientific world.
What is the benefit of having it in a tablet versus having it in a liquid, or having it in a liquid versus having it in a tablet?
Well, because of the biomechanics of interferon alpha and the pharmacology of lozenges or pills, you can pretty much place 5 million international units of interferon on the tip of a pen. 5 million international units. And so to try to disperse, 200 international units in a lozenge, a pill, and get that to be consistent is almost impossible. It's impragmatic. So this is why when I tested Mr. Larry Green's products, his pills, when I was at Johns Hopkins Med School, they were inconsistent. Some had 0 international units of activity, some had 50, some had 150, some had 500. And so the biomechanics of trying to get 200 international units consistent in a tablet or a lozenge it's just not practical. And so I knew that, and I didn't want to follow in the same tracks that Mr. Larry Green had done, and probably everybody else that produced the cytokine in a lozenge. But I did know from just my biochemistry training and general chemistry training and years in a laboratory that a solution, a liquid, is always going to be more stable as long as you have buffers in the liquid. It's going to be more stable. It's going to be more consistent because 200 international units per milliliter is 200 international units per milliliter. And the most that you may have to do is invert the bottle a couple of times to make sure that the suspension is properly dispersed and it becomes a homogeneous mixture. It's just that simple.
Thank you for that. Hold on one second for me, please. Okay, so let's go back to 1994. You're contacted by Dr. Ali Muhammad. Can you give us the scenario that was surrounding that contact, and what was the environment going on in the Abundant Life Clinic with his patients at the time, per your knowledge?
Well, based on what he said when he called me, the lozenges that he had been receiving either from Kenya, Australia, or Japan had been confiscated by FDA at Dulles Airport. According to what he told me over the telephone, his patients were becoming sick, and I believe some of them had died because they could not get the interferon product. And beyond that, I don't know. But that's what he told me when he called me at my laboratory.
So moving forward, at what point did you bring him your creation or invention in the liquid low-dose alpha interferon to the Abundant Life Clinic in Washington, D.C.?
In November 1994, I don't remember the date, but November 1994.
So there was an announcement in October of 1995 at the Million Man March of brother Demetrius Muhammad going from HIV positive to HIV negative. And I can say that we do have Mr. Demetrius Muhammad's interview as it relates to his experience with your product on Nature's V Autoimmune Disease Foundation's YouTube channel, where he recalls his involvement with your product. But do you remember him being in the Abundant Life Clinic and using your
I
product?
do. Yes, we were there together. During that same time, it was a very demanding time for me. It wasn't stressful, but it was demanding because at the time I was functioning in 2 research labs at Howard University's Med School and Cancer Center. I was doing cancer research at the Howard University Cancer Center, and I was doing pediatric immunology research in the med school, graft versus host disease research. I was the minister of the mosque in Norfolk, Virginia at that time, and I was a husband and a father all at the same time. And I was now managing a budgeting business because we had to create a business in order to properly market the new product that we had the privilege of developing.
To your knowledge, is the product that caused Mr. Demetrius Muhammad to go from HIV positive to HIV negative IB100?
It is. It wasn't known as IB100 at that time, but yes, it is the same product. It is the IB100. Yes, it's the product that we were blessed to develop.
And is the IB100 historically the same product that the 14 to 15 different medical offices around the United States that were dealing with HIV were using at the time also through the
It
Abundant
is.
Life Clinic?
It is. I know for certain of about six: New York City, Harlem, Chicago, Atlanta, Los Angeles, San Francisco, and Washington, D.C.
So that would be the product that Dr. Barber
Justice.
Jordan was using, Justice was using,
Justice.
Justice,
Right.
and Dr.
Right.
Wilbur Jordan were using.
Yes, sir.
Okay. Moving forward, as we review and try to bring the saga up to modern day occurrences, we're having a lot of success at Nature's V and other offices that are currently using your product as it relates to autoimmune diseases, cancer, um, thyroid issues, um, liver cancer, kidney failure. What would you attribute the the product's efficacy in these areas to as a biomedical scientist, and especially, well, your product, because it's your product that is having these type of results as other products that say they're of the same class or nature or not? Why is your product so successful?
Well, if you review the literature, the medical literature, you'll find that most of the experiments or trials that have been done using interferon alpha, they have bolus concentrations. And what is intended by bolus concentrations is that they will do 18 million international units IV continuous flow for 24 hours. 18 million international units continuous flow IV for 24 hours. The body doesn't produce anything in such a high concentration. The Western world has a mentality that pretty much crosses every genre of human behavior, where more is better. That's the Western mentality, and that is not the way the body functions. The body produces interferon alpha only when there is a viral infection. And when the body produces it, it is released at picomole concentration. And if I remember correctly, that's about 10 to the minus, maybe 10 to the minus billion concentration. And so 18 million international units, continuous flow, IV, is just not the proper application. It's too much. And so it creates a toxicity in the body. And when you read the literature, they say it produces flu-like symptoms. Well, because you've overburdened the immune system and you've saturated the person's body with that supplement or with that product. And that's not the way the body does it. Our product is only 200 international. The product we used with Dr. Muhammad and all the other doctors was only 200 international units per milliliter or cc.
So just as a note, Mr. Demetrius Muhammad is on Facebook and he sent you the greeting. We've lost your camera, Mr. Victor Muhammad.
Yeah, I know. Give me 1 second. You can continue to talk, though.
Okay, thank you. Just for our viewing audience, we wanted to make sure that you had the opportunity to have access to the best health that we know that is available in 2021. We at Nature's V and Life Sciences of Washington, Health at its Best, um, the Ultimate Wellness Group, and others who are now providing this product, IB100 and other products, to people who would like to be involved with a better level of health created by biomedical research scientist Victor Muhammad in the products branded as IB100, which is well, why don't you explain to them the difference in the products, Mr. Victor Muhammad? Because coming from you, it's a totally different explanation.
The difference in which products?
IB100, IB119, IB30, and OU7.
Okay. The IB100 is a product that contains amino acids that has demonstrated antiviral properties, antiviral activity. The IB19 is a biomedical product that is contained, it also contains amino acids that have demonstrated antibacterial properties over the years. The IB30 is the same as the IB100, but it is a third of the concentration of the IB100. So it is something that a person could take on a daily basis if they weren't infected with anything, but it could be used as a preventive product, if you will. The OU7, or Okoi Uhai, that is Swahili for save lives. Okoi Uhai is Swahili for save lives. And OU7, or Okoi Uhai 7 in Islamic nomenclature refers to elevated places. And a person whose life has been saved does go to an elevated place. So
Yes, sir.
the OU7, or Okoi Uhai 7, is a combination of IB100 and IB19. So you get the best of both worlds by taking one product. And that's how we came up with that one.
A person going through radiation therapy or chemotherapy, we had a question. Which of the dietary supplements that you provide would they use if they were either in the treatment or trying to recover from the treatment?
For cancer?
Yes, sir.
Well, based on the literature that we've read, we believe that the amino acids in the OU7, no, I'm sorry, the amino acids of the IB19 would provide them some benefit and some relief. These are not drugs, so we don't make claims about them because they're not drugs. And these are dietary supplements. So, but we believe that that particular one would provide you some benefit.
We have a question from Naira. She wants to know, can pregnant women take this product?
It's a dietary supplement, so we don't know of any reason why a pregnant person wouldn't take it or would have any problems with it. These are not drugs, and you know, we don't know of any reason why a pregnant woman couldn't take it.
We have another question that asked, um, which of the dietary supplements would you suggest for a woman suffering from fibromyalgia or fibroid tumors?
Um, she would probably attain the best benefits from the IB 100 because
Thank you.
we believe that fibroid cysts are derived from viral infections. So, yeah.
Thank you very much, Mr. Muhammad. We've kind of ran over time. I want to know if there's anything that you would like to express. I know I've been hammering you with these questions, but we do want to um, be able to get as much information out as we can, and we know that your time is valuable. We have a question from Natalie. Will this help people on dialysis?
Yes, actually, we had a recording of Mr. Raymond Muhammad some maybe a month ago where uh, he benefited from it. He wasn't on dialysis, but dialysis had been recommended to him. But he started taking this product, the IB 100, and you can go on YouTube and see his own exaltation and hear it with your own ears. So yes, based on what we've seen with Mr. Raymond Muhammad, we believe that you would receive some benefit.
About a week ago, I did an interview with a middle-aged African American woman, and her interview is on Nature's V Autoimmune Disease Foundation, and she was dealing with a thyroid goiter, and she reported that after using the product for approximately maybe 2 months, that goiter had reduced itself um, using IB 100. Does that sound consistent with the characteristics that are found in the product that you've created?
It does. In the last 2 to 3 years, we've found that this product goes far beyond what I knew for 27 years of its capabilities, just in the last 2 to 3 years. So, what it appears in my 37 years of being involved in animal research and biomedical research, it appears that many of what are called diseases in both man and animal are derived from microbial infections, bacteria, viruses, protozoa, prions, fungus. And if we would begin to stop taking such extreme measures and techniques to investigate a disease and utilize some simple approaches, then we would find that it's not difficult to treat a disease or to heal people. But the approach that has been used since Hippocrates introduced Western medicine to the world after he went to the banks of the Nile and learned how to treat and the science of what was then medicine, he altered it some and made it what it is today. And that approach, I cannot deny that it does present some benefit, but I believe that all would agree who are reasonable that what we have come to know as Western medicine is far more deleterious than it is beneficial. So, so no, it doesn't surprise me that the lady received some benefit by taking the 100.
We're now in a season of cold and flu, and we're under a pandemic that has found a new influenza dealing in the world after many influenzas have come across the hit time the timeline of history. Do you see or know that people would find a benefit in any of the dietary supplements that you currently are producing at Life Science of Washington's in the influenza seasons? What would be a protocol you would prescribe to people to not fall victim to the flu or influenzas as they are currently being touted every day?
I have said in the past, in the recent past, that I don't know if it's intentional or if it's an act of nature, but I do believe that something or someone has done something to alter the human's ability to produce and release cytokines like the interferons. And it is not normal for a person to get diseases. Rubella, whooping cough, the common cold, the flu, coronavirus, COVID-19, cancer. These are not normal. And we have accepted them as the norm, but it's not normal because the body is designed to fight off any kind of infection. And so if a person in August, late July, began taking a dietary supplement like the IB30, by the time cold and flu season emerged in late October, November, then their immune system would already be comparable to be able to combat these infections. So you probably would not contract what is being called coronavirus or COVID-19. You probably would not contract influenza or the flu or the rhinovirus or the common cold. This is what we believe.
So, as we close, and the people watching are happy with what you're relaying as it relates to the information, and they're happy to see you, and they're appreciative of what you have offered. Can you? We like to close with the new health paradigm, and can you give us some information on the new health paradigm, as much as you intend to share, and then we'll close out with some closing remarks and your last words, if that's all right with you.
The the new health paradigm will address every single component of the human being. There is no way we can make and maintain stable health in the human family without addressing every component of the human and those things that constitute the human. There are many factors that are causing poor health in the human being. And until we address all of those factors, then we're going to go in a circle. I won't go and I won't be more specific than that because already people have listened to some of the things that we said and they've attempted to get out in front of us. So that's all that I'll say at this time.
And I tried to cover everything that was said on the video. Did I miss anything that you can call that you wanted to address?
Yes, sir. Dr. Aleem stated that in the video, and anyone can go and listen, that the product that I developed, the liquid product, wasn't as stable as the lozenges. And that was not true. That is not true. And I would ask Dr. Aleem to put forth in a video or in writing his argument for why he made that statement that my liquid product was not as stable as a lozenge, or it wasn't as stable. As stable as what? See, that's a very broad statement, and in a legal argument, you couldn't defend that because it's too broad. So I would like for Dr. Aleem to address that. What did you intend with your statement, sir?
Isn't your product the only product that we know scientifically to ever cause an individual like Demetrius Muhammad to deconvert from HIV positive to HIV negative in the history of science?
It's the only one in modern science that we know, and what I intend by modern science in the last 6,400 years. Most of the records that precede 6,400 years were destroyed when the Europeans went into what is now Egypt, Iraq, Iran, Arabia. They destroyed all those records, and those that they wanted to keep, they took back to Europe. And right now, they're in the basements in the libraries in Europe. But to modern, but in accordance to modern uh, medicine and science, no, there was no record prior to Demetrius Muhammad in 1994.
Demetrius Muhammad just put in the text that he took the product to overcome COVID-19. He just texted that just for to put that forward. Um, why do we find such a great success with things that are dealing with autoimmune diseases? The great successes that people are having with getting over herpes, with getting over lupus. Um, what do you say? What do you think is taking place in the human body? I know you've covered it, but just because he put it out there again, people even getting off of their antivirals now and no longer taking the true Victarias and the Truvadas that are causing all of the side effects and are living great lives on your product. What do you attest that to?
Simplicity. If you study nature, everything in nature is simple. If you pay attention to the Western world and the science and technology of the Western world, everything is complicated. There is the number of clinical trials that FDA takes, through which FDA takes a product. It's unnecessary. The amount of research that they do to investigate a product, it's too much. It's too much money, and it's too much. Um, the products that we developed, we only mimic what the body naturally does. And since the body has been compromised with our lifestyles in the Western world, then we need exogenous or external sources of the same thing that the body would be doing if the body were allowed to be healthy. The body, most of the bodies that we have in the Western world, they're already shot. By the time we're 25, our bodies are pretty much shot. At 35, we're going downhill, and it's because of the lifestyle that we live. We eat too much meat. You cannot be healthy eating meat 3 times a day. I'll give you an example. The average breakfast that a person eats in the breakfast is not a good breakfast according to Western society unless you have sausage, ham, bacon, eggs, and toast. No vegetables, no fruit, sausage, bacon, ham, eggs, and toast. Four different meats. Now, how can
Well,
you possibly be healthy? No. So it's simple.
last question. I know we got time, and I'm sorry for going over, but the questions are coming. Um, what would you attribute to those who are having success on the IB 100 as it relates to type 1 and type 2 diabetes? Those who have gotten off of their insulin and those whose A1C is lowering by their own um, testimony.
I've never been one who ascribed to the belief that diabetes comes from the amount of sugar that a person eats. I don't believe that. I never believed that. I believe that some diabetes come from the amount of starch that a person consumes. And in America, particularly, we eat a lot of processed um, starches, spaghetti in the box, macaroni in the box. We love macaroni and cheese in the meals. We're eating white bread instead of whole wheat bread. We're eating white potatoes, white sugar, but mostly the starches that I'm naming. Um, and all these things are just laden with starch. And I believe that that is the underlying factor behind a great portion of diabetes. The other part, I believe that what is termed and the nomenclature assigned to the activity of diabetes is it comes from, I believe, a bacterial or viral infection. I do. Um, because I haven't seen any evidence that sugar is associated with what is called diabetes.
Well, actually, we've talked about this, but the Autoimmune Disease Associations of the United States have now classified diabetes as an autoimmune disease, which most autoimmune diseases are of a viral nature. So that would be consistent with what you believe. I thank you for your time tonight, Mr. Victor Muhammad. Do you have anything else that you'd like to say to your listening audience tonight as it relates to what you have to offer?
Yes, sir. Uh, for many years, um, we have held information that the public has a right to know regarding the clinical trials from the interferon alpha clinical trial studies that was to take place in the 1990s. In I remember the people who responded to the call of Minister Louis Farrakhan to come and help us in the 90s with the interferon product. And people responded to Minister Farrakhan, and they came, all kinds of people, people from all different professions, politicians, mayors, medical doctors, dentists, researchers, you name it, nurses. They came to help. And I remember I first heard Minister Farrakhan. I was working on my PhD at Ohio State University in 1988 when I heard Minister Farrakhan on a VHS video. And I was convinced at that point that whatever that man was, whoever he was, whatever that was, I was going to join it. I didn't know what it was. And so in
Right.
1989, I did join. Little did I know I was being called into the Nation of Islam to start on a 31-year saga now that has dealt with this interferon product for now 31 years. And I didn't know that when I saw him in 1988 at the Ohio State University. So because of the people's response to Minister Farrakhan to come and help us, the people deserve to know what happened with that clinical trial for the alpha interferon back in the 1990s, because it just disappeared and no one has heard anything and no one has provided the people with an explanation, and people put their careers on the line to heed Minister Farrakhan's call. And so we owe them an explanation. So in the coming weeks, we intend to give you an explanation. We intend to give you as much actual fact as we have.
And that would be the clinical trials as it relates to the use of an interferon product for HIV.
Yes.
Okay. Thank you very much, Mr. Victor Muhammad. Thank you for our viewing audience for being patient with us tonight. We thank you for giving us your time. We have now concluded our interview with Mr. Victor Muhammad of Life Sciences of Washington, biomedical research scientist, agricultural research scientist. My name is Eric Ahad with natures-v.com. I'll give everybody greetings and good night.
Good night.